Good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer for OU Health, and I am the university's Chief COVID Officer. I'm going to give a brief update of where we're at with respect to the pandemic as of today's data, and then share a couple of articles that have come out in the past week that I think are important for people to know about, and I'll be happy to answer questions. A handout will come out that has all the information in it. So Oklahoma, as of this morning, per CDC data, ranked 9th in the nation in terms of new cases per week. Florida, South Carolina, Mississippi, Kentucky. If you look at a national map, you can see that the Delta variant is spreading rapidly through the southeastern United States now, has come up out of Florida into Alabama, Mississippi, Georgia, and now South Carolina, West Virginia, Kentucky, and Tennessee. So our cases are still up. As of this morning, we were at 71 cases per 100,000 population per day. There were 2,538 new cases reported today, 33 more deaths reported in Oklahoma, so that puts us just below 9,200 deaths in the state since the start of the pandemic. The 7-day rolling average is actually leveled out. For the past 4 days, we've been right around 2,800 new cases per day. We've seen that happen before, and about a week ago, remember that we were at about 2,100 cases a day, and we saw this very rapid rise in new cases per day that happened in the state. So I'm not going to state at any point yet that we're at a plateau. I think we need to watch the data quite carefully. The most new cases in the state today were reported in Oklahoma County, with more than 3,500 cases in Oklahoma County. Tulsa County followed with 2,900 cases, in Cleveland County with just over 1,300 new cases in the past week. Hospitalizations have come down just a little bit. As of today, the report shows that we're at 1,539 cases in the I'm not sure I updated that. Doing things very right. We're at 1,566. I'm sorry, I did not update that. 1,566 cases today in the hospital, with 441 people in the intensive care unit, so just under a third are in the intensive care unit. And again, because of that, I think everybody is aware that we will see more deaths in the state from COVID-19, because you have to be very, very sick to get admitted to an ICU with COVID-19. And then, very importantly, some of those patients will be in the hospital for weeks. So I think hospital capacity is going to be tied up for some period of time to come because of the number of people that are in the intensive care unit. And then finally, the last of the data slides just simply shows the CDC's transmission map that again shows that, except for Harmon County, the entire state is in substantial or very high community transmission of COVID-19 at this point. So because of that, the CDC recommends that everybody wear a mask, vaccinated or not, when you're indoors. A couple of studies that have come out this week that I thought were interesting that I wanted to highlight. One was, for some time we've had a suspicion that people infected with the Delta variant get sicker than people who were infected with the original Alpha variant. So the strain of the virus that we were dealing with in December, January did not appear to be as virulent, and we're seeing it. I think I've highlighted before that case counts have gone up a lot over the past 2 months, but hospitalization rates went up even more. And in fact, a paper came out from England this week with 43,000 COVID-19 patients, and they showed that people infected with the Delta variant were 2.3 times more likely to be admitted to the hospital than people who were infected with the original Alpha variant. Again, it just simply highlights that it's part of the reason that we're seeing hospitalizations go up so dramatically from COVID-19 in the United States, because Delta variant puts more people in the hospital. Again, a very important reason to go out and get vaccinated, because in the study, 74% of the people who were hospitalized were unvaccinated. The second study was one that I found interesting. even here in the Health Sciences Center, when we see people, employees, staff, or others who get infected with COVID-19, the vast majority of the time we can trace the exposure to an event that happens outside of our healthcare setting. We're very strict about wearing personal protective equipment and other things here at the Health Sciences Center, so we see very few occupational exposures to COVID-19, but we do see people get infected, and it's usually at home. Well, we've known for quite some time that household contacts is a common place that people get infected with COVID-19. If you live with somebody who is infected, your chance of getting infected goes up dramatically. So this was a very large study, what they call a meta-analysis, 87 studies with 1.2 million people in the study. Now, the 1.2 million people were household contacts of somebody that was positive for COVID-19. And if you just look at the entire duration of the study since the start of the pandemic, 18.9% of the household contacts that lived with somebody with COVID became infected. However, if you look at the studies that were done early in the pandemic, it was only about 13%. But now with different variants spreading around the world, and this was a multi-country study, 31% of household contacts became infected since July of 2020. So the important thing to note is living with somebody who tests positive for COVID puts you at substantial risk. About a third of the people will get infected with COVID-19. It's a high risk for infection from COVID-19. The third study I just wanted to mention was a research letter that came out this morning, and by the way, I've put references in for all of this information. It was a study of 2,500 healthcare workers who were vaccinated with either the Moderna vaccine or the Pfizer vaccine. And the key findings, there were three key findings in the study. And again, it's just a short research letter, but I found it very interesting. Patients who received the Moderna vaccine had antibody titers that were twice as high as people who got the Pfizer vaccine. That was after 2 doses. Patients who had previously had COVID-19 with either one of the vaccines always got more antibody response than people who had not been previously infected. And we've seen that before. Previous infection with COVID does give you some protection, but if you get vaccinated, you get really high antibody levels, and they showed that with both Moderna and the Pfizer vaccine. And then finally, something else that we've known for some time, and that there is an inverse relationship between antibody levels, how high of an antibody level you get, and your age. So older people don't get as high of an antibody response as younger people. People below the age of 35 got very high antibody responses when they were vaccinated. The last thing I want to mention may have some relevance for some of the questions that have already come in today, and that's an interesting article that was in the New York Times this morning that I don't consider a scientific study, but very interesting thoughts that they've raised about Delta variant in particular. And they've seen this cycle worldwide, that when Delta variant comes into a country, you see this enormous expansion, increase in cases for about 2 months, and then you start seeing the cases fall off. Now, how they fall off can be different. In India, they dropped dramatically, but in many U.S. states that are seeing outbreaks of Delta variant, they've seen the cases go up dramatically, but now they're coming down much more slowly. And if I were to predict, I would think that Oklahoma probably would be in that category, that we may start to peak soon because we're just under 2 months out from the real uptick that occurred because of Delta variant. But because we have so many unvaccinated people in Oklahoma, I don't think we're going to see that dramatic drop in the number of cases. If we see a drop, it's going to be a lot more gradual. But it's an interesting study. I put a couple of graphics in and the reference in today's New York Times. So just an interesting study, because we get a lot of questions about, are we peaking yet? Will we peak? What will happen after the peak? So I'm going to stop there and answer questions.
Okay. When you said that Harmon County was the only one that's not in the red, where is that, and what do you think the reason for that is?
Well, it's hard to know. So Harmon County is actually in the low community transmission. It's blue right now on the CDC map. So it's at the lowest levels of transmission. And there's a variety of reasons. It's a very rural county, very low population in that county. I don't know what their vaccination rate is. It's also possible that quite a few people have already had COVID in the county, and so it's just not spreading, or that they're just not doing any tests, to be honest, because if you don't do tests, you don't identify cases, and then in the CDC data, you're going to look like you're very low for transmission.
Okay, and you said we're 9th in the nation this week. Were we 11th last week?
It's varied week to week, and part of it is because other states now are moving up rapidly. Like South Carolina had not been a hot spot for COVID-19. Now it's number 2 in the nation, just behind Florida. So Oklahoma this week was 9th because we had this big spike in new cases this past week. Everybody's talking. I heard Mayor Holt talking about it yesterday. We've seen this tremendous growth in cases within a 1-week period, which I attribute to the fact that we opened schools. And so that brought our numbers up this past week. So far this week, our numbers have been flat.
On when you're referencing the Pfizer-Moderna studies, you mentioned that older people don't have as high antibodies after vaccination. So, is the booster even more important for the seniors? Are they thinking?
So the question is, since we know that older people don't get as high of antibody response as younger people when they get either Pfizer or Moderna, will that make boosters more important? So let me first say a couple of things. There's not great understanding of correlation of antibody levels and risk of COVID infection. We don't know what level of antibodies any individual needs to have to keep them from getting COVID. So I want to always be cautious about that, to not put too much emphasis on antibody levels. And it's one of the reasons that for the most part we don't do antibody tests, because they don't help us take care of patients. But if you look at the state's weekly epidemiologic report, and the new one will come out today, on the percentage of people who are unvaccinated and fully vaccinated that go into the hospital, if you look at that fully vaccinated group, it's only around 6 to 7% of the people in the hospital are fully vaccinated, but 3/4 of those people are elderly, which suggests to me that maybe the elderly are seeing some waning immunity, and I would think that elderly people would be a higher priority for COVID booster shots. That's the other thing that came out this week I didn't talk about. Everybody's probably heard this general conversation that boosters will be recommended starting maybe September 20th if you're more than either 6 or 8 months after. The CDC has actually questioned that recommendation because CDC in their conversations this week talked about maybe a risk-based approach. There are clearly people who are at greater risk of complications of COVID if they get it than just going out and routinely revaccinating everybody where there's not good evidence necessarily that it will actually improve their outcomes. So the elderly, I think, would be a category that a lot of people might recommend a booster for, just because we know that breakthrough infections are a bit more common, and when they get a breakthrough infection, sometimes they end up in the hospital.
Okay, Erica Rankin's asking these questions. Are we still working to get herd immunity, or is it just impossible?
Yeah, so I think on one of our previous press briefings, I talked about that, and quite a few epidemiologists now feel that with changing variants, herd immunity is impossible. So you could argue, we had suggested that 30 to 50% of all Oklahomans in the first 2 waves of COVID had been infected already. And then 30 to 40% of people became fully vaccinated, and yet we saw Delta spread through the state very, very rapidly. It's a new variant, new virus. Just because you'd already had COVID didn't necessarily protect you. Being fully vaccinated didn't necessarily protect you. Now I have multiple studies that have been published within the last few weeks that have shown that about 25% of the people who are getting COVID infections now are fully vaccinated. They don't get nearly as sick usually, but breakthrough infections, I think, are quite common. So it's a new virus. It's behaving differently. So how do you get to herd immunity if you keep changing the virus? So a lot of people think that we can't get there. We know this particular virus is very contagious, so it would take a very high level of immunity in the population to get to herd immunity.
What do we need to get back to a normal life?
Well, so here I'm going to say a couple of things. Vaccination is the number one strategy because it definitely prevents a lot of COVID infections. And it really opens up our hospitals by reducing hospitalization. So that's the number one priority. I've said it before, but the United States does have an obligation to help the rest of the world get vaccinated. We're dealing with Delta variant now that came to us from India. There are other parts of the world right now that are seeing unmitigated rapid spread of COVID-19, and that's where mutations will happen that will develop the next variant that may come along. So until we get worldwide, high levels of vaccination, and as long as COVID can spread rapidly, we're still going to see mutations that result potentially in another Delta-like event like we've had this summer. Nobody thought we would be doing that, this summer, but it's a new virus. And the same thing could happen. So the most important thing is to get as many people vaccinated as possible, which slows the spread, reduces mutations worldwide. At the same time, wearing a mask is incredibly effective at preventing transmission of COVID-19 from one person to another. So to help slow the spread, wearing a mask is really important. Physical distancing works, washing your hands, all of those things are really important for preventing all infections. But those are the things we need to do right now.
And do we think, will new variants ever stop coming about?
As long as, so the question is, will new variants ever stop coming about? No. As long as the virus can keep spreading, replicating, mutations will occur. Faster virus, and the more that a virus replicates, the more likely mutations are. So if we can slow transmission, slow replication of the virus, we can reduce mutations.
Got some wastewater surveillance questions. Given the concentration is at levels not seen since before the winter surge, is the pandemic about to ramp up again on top of what we're already experiencing?
Yeah, so I have seen some of the wastewater data, and I know that the counts in sewage have been very, very high. I'm not sure yet how to interpret it. So we knew from the Alpha variant that when we saw surges in the virus count in wastewater, that we saw subsequent increase in cases in that community. And maybe we'll see the same thing again. The one caveat I want to mention is that Delta variant, remember, it grows rapidly. If you're infected, you carry 1,000 to 1,200 times more virus than you did when you were infected with Alpha variant. Now, does it get into the sewage? Because is part of the large numbers that we're seeing because the virus replicates so rapidly. There was an article this week that proved that the virus can actually replicate in your colon. So again, I'm not exactly sure how to interpret the numbers. What we need to do is watch wastewater counts and correlate them with actual case counts to learn more how to use that data.
So on that same vein, what does the high level of COVID and wastewater tell us about how many COVID infections we might be missing in statewide cases?
So I think that's a really good question. So the high wastewater levels of virus, COVID-19 virus, what's it tell us about cases that we might be missing in the community? I think we miss a bunch of cases in the community. We're not doing enough testing. People who are direct contacts or exposed are not getting tested. Testing is a bit hard to find right now, and so I think we miss a lot of cases. I think today's report from the State Health Department reported that there were 21 or 22,000 actively infected patients in the state, but we know that number grossly underestimates the real number of people in the community that are infected. Didn't get a test, were completely asymptomatic, so didn't even know they were infected, or had minimal symptoms and they attributed them to allergies or other things and they just never got a test done. Most studies suggest that the number of people infected in the community is usually multi-fold higher than the number of people who had a test that was positive that the health department can report as an active case. So I think we miss a lot. I think there are a lot more people out there. And let's just assume that the state health department number of 20,000 people are actively infected in the community is correct. Well, that would mean 5 out of every 1,000 Oklahomans are infected. And so just remember that you're out in a crowd, particularly if it's a very large crowd, that, 5 out of every 1,000 people could be infected and could be spreading the virus. They may know it, they may not. Last week's press briefing, I highlighted the study that showed that when you get infected with COVID-19, you start spreading the virus for 2 days before you have symptoms. That's similar to what happens with the flu. So you could be spreading the virus and feel perfectly fine. So again, in public settings, particularly indoors, assume anybody you encounter could be infected and wear a mask to protect yourself.
Okay. Are confirmed cases or hospitalizations in danger of each respectively flirting with or breaking records in the near future or the end of the year?
So the question is about the either confirmed cases or hospitalizations. Are we in danger of approaching the levels that we did in January? I don't think we will with confirmed cases because there have been so many people infected that have at least partial immunity, and we have a lot more people vaccinated. So I don't think we'll get to the levels that we saw in January for confirmed cases. Hospitalizations I've been concerned about because they've gone up faster than confirmed cases. And that's because we know now that the Delta variant, you're about twice as likely to end up in a hospital infected with Delta variant as you were with the original Alpha variant. So hospitalizations are really high at the same time that there's reduced capacity to take care of those patients.
People are saying that wearing a cloth mask to stop a virus is like using a chain link fence to stop a mosquito. How do you respond?
All right, so I really wanted to answer this question. It's one of the most common incorrect pieces of information that's being spread on the internet, that cloth masks don't work because the virus is so small it can go right through it. So the analogy that in the question was, it's like using a chain link fence to stop a mosquito. Remember, when you breathe, cough, sneeze, sing, bare virus is not coming out of your mouth. The virus comes out on droplets. So I've seen that in so many different presentations. The virus is 50 to 150 nanometers. That can go through a cloth mask. Absolutely, that's true. It can go through a KN95, it can go through a surgical mask. But that's not how the virus comes out of your mouth. It comes out riding droplets, aerosols and droplets. And cloth masks are incredibly effective at preventing droplets and aerosols from coming out of your mouth. They're not perfect, but they're very good. Just wear a mask for a few hours and feel the inside of it. You'll feel the moisture on the inside of the mask. That's why we ask you to wash the mask frequently. They're very effective, and multiple studies have shown that when both people are wearing a mask, even a simple 2-layer cloth mask, it dramatically reduces droplets and aerosols that come out of your mouth. It reduces that zone of contamination that's around you and protects both parties. Thanks for asking that one.
That was from Channel 4. Are you seeing increased hospitalizations of pregnant women with COVID-19, and what greater risk do expectant mothers face with the Delta variant?
I think in last week's press briefing, I talked about some of the studies in pregnancy. So, first, pregnant women don't want to get COVID-19. If a pregnant woman, particularly the time of delivery, gets COVID-19 or has COVID-19, the chance of mortality for that pregnant woman, which is typically quite low, but it goes up 15-fold. Their chance of being on a ventilator, 14 times higher. So pregnant women, we do not want them to get COVID, and that's why we recommend that all pregnant women be vaccinated. It also increases the likelihood, if you're pregnant, get COVID, of preterm birth. And we've seen that around the country with higher rates of preterm birth. So with the Delta variant being about likely to double your hospitalization rate, yes, we've seen more pregnant women who've come in with COVID-19, and sometimes, hopefully, sadly, they have complications.
Have you seen any data on how we're doing with supplies like oxygen gases and PPE, and how will that affect our ability to care for patients?
Yeah, so the questions about both personal protective equipment and oxygen, I can't really comment on oxygen. I'm not in that supply chain. I've heard all the reports, and I know, for instance, the city of Norman went to alternate watering to reduce their use of oxygen. I haven't heard of any shortages immediately in our metro hospitals, but that's not my job to track supplies. PPE, though, we do get routine reports. I think most of the health systems really stocked up this past year, and I think PPE supplies are adequate.
If a school were to issue a mask mandate next week, now if they can, in your opinion, is it too late to have any effect? Many kids have been in school now for over a week.
Yeah, so the question is, would a mask mandate in a school, let's say theoretically that they could do it, would that have any impact on cases in the school? I think yes, it would, but I know it'll also have an impact on things like the flu and RSV and other infections. Remember that even kids that are fully vaccinated, they can get infected with Delta. People who have previously had COVID exposed to Delta can get reinfected. So we're not out of this pandemic yet. The case counts are still high. They're still in schools. The majority of kids are unvaccinated. And so I think it's very, very important that we follow the CDC recommendations that all kids in school should be wearing a mask, and any indoor setting should be wearing a mask.
Okay, no more questions. Anything for you?
Nope, thanks for the mask question. I love that.